Now we're going to talk about something that's really exciting, is by learning this technique, this is going to put you so far ahead of other people in the community in dealing with frozen shoulders and fixing shoulders that you're going to find things happening very dynamically with your practice. So there's a capsule around this shoulder joint, the glenohumeral joint. And that capsule and joint capsules in general are sort of like a combination of saran wrap and canvas, if you can believe that. So it's very stiff, but like saran wrap, even though it's stiff, when it changes its shape, it doesn't want to go back to the original shape. So when you have this frozen joint capsule where the synovial fluid is very thick and the capsule is gluing to the head of the humerus, we're going to have to stretch that. And the way we stretch that is to use the head of the humerus as a battering ram. And I'm going to share with you my secret techniques for stretching that joint capsule out and fixing frozen shoulders so quickly that you and your patients will be amazed. So remember when we talked about the shoulder before, in the basic part of the training, that the shoulder often goes forward and up. So we then, to counterbalance that, we gently pull the humerus or arm bone down or inferiorly, and then we push on the head of the humerus posteriorly. So I push from A to P, anterior to posterior, and then I pull it down inferiorly, very gently. Then I push it A to P, and then I pull it inferiorly. And that's how we're going to start off treating a frozen shoulder. And once you learn how to treat a frozen shoulder this way, you're going to find your frozen shoulders will get better so rapidly, you'll be amazed. Very often, the person can't flex more than about here. And in that case, what you're doing is you're going to be putting your indifferent hand on the scapula while you're pushing the humerus superiorly and posteriorly to stretch that joint capsule. And as you do this, you'll feel the shoulder flex more. And you push and then release. Now, if this is very hard, if someone's really frozen, you can even put it against your body and hold it and lean so you don't have to use too much force in your arms. And as it goes up, you continue to use the head of the humerus as a battering ram. I'm pushing and then releasing. And then it goes higher. And see, I'm using my body weight so I don't have to strain myself. And I push posteriorly and inferiorly, and then release. And as I push, it becomes looser and looser. And finally, we have a flexible shoulder joint. So besides the battering ram, to rapidly fix frozen shoulders, we're also going to use a behind the back stretch. And you're going to do battering ram behind the back, battering ram behind the back. By doing that, you'll be getting all of the cardinal ranges of motion of the shoulder. Just to give you a close-up of this, I'm very gently moving the head of the humerus inferiorly, because remember, the shoulder will go forward and up. And then I take her arm behind her back, and in this position, I allow it to drop very gently, and then I rotate it internally and externally very gently until I find out which range of motion helps produce the most behind the back stretch. And I'm seeing, of course, as I mentioned, that internal rotation is really dramatically stretching this, and external rotation is kind of blocking it. So I'm going to internally rotate her arm. And if you go back and forth between battering ram and behind the back, you will find that most frozen shoulders will get better very rapidly and with very little pain.